Thank you, everyone, for joining us this morning. We have some interesting research, and our embargo just lifted on this, hence the the quick notice. But we have Stephen Goldstein, PhD. He is a virologist and postdoctoral research here with us at the U of U School of Medicine. And he was a co-author on a study that was just issued this morning in today's issue of Science magazine. And there is some new research about the origin of the SARS-CoV-2 virus. And there has been so much information that's been out about the origin of this virus, where it actually came from. Was it in the markets in Wuhan? So Dr. Goldstein is going to present his findings today and hopefully give us a little bit more definitive information about where the virus came from, what that means, what we know about it, and what that can help us learn about how the virus is mutating and what that might mean for us in the future for other kinds of SARS viruses. So Dr. Goldstein, why don't you kind of lay out your findings, what you've learned, what we know, what we don't know, and then we'd like to open it up for a Q&A from there. Thank you.
Great, thank you. So yeah, as Suzanne mentioned, a paper out this morning on which I'm a co-author in Science, and there's also a companion paper that came out along with this one that I'm not a co-author on, but that provides some data and findings that are very complementary to the paper that I'm a co-author on. So I'll just run down a few of the key points, and then as Suzanne said, I'm happy to take questions. So the first thing we looked at is the geographic distribution of early cases of COVID-19 in Wuhan and how those compared to the location of the Huanan live animal market that was an early focus of the investigations. So what we found, as we knew previously, is that cases with a known epidemiological link to the market clustered around the market. But there had been this question about whether that was simply because of something called ascertainment bias, whether the Chinese public health officials were looking for cases of unusual pneumonia that had links to the market. So what we were actually able to do is locate the cases that did not have a known epidemiological link to the market. So the person did not work at the market, the person did not shop at the market, they didn't live with somebody who did one of those things. And we actually found that the average distance of unlinked cases to the market was significantly less than the average distance for linked cases. So unlinked cases were on average 2 to 4 times closer to the market than the linked cases, indicating that in December 2019, really the only place in Wuhan that this virus was circulating, SARS-CoV-2 was circulating, was in the neighborhood immediately surrounding the Huanan market. So the idea that the virus was quietly circulating throughout Wuhan and then just introduced to the market where there was a super spreading event, we're able to disprove that possibility. Another key finding is the finding that 2 different lineages or very early variants of SARS-CoV-2 were geographically associated with the Huanan market. So previously, only one of these lineages, lineage B, had been associated with the market. And if the origin of the virus was inside the market, then it should have been the case that both early lineages should be associated with the market. So looking at the geographical locations of the lineage B cases and also the 2 earliest lineage A cases that we have information for, we actually found that the average distance of the lineage A cases was closer than for the lineage B cases. And in a stroke of fortune, or certainly an interesting scientific finding, around the time we originally released these findings via preprint, preprint was also released by the China CDC, identifying an actual lineage A environmental sample from inside the market, basically confirming our geographical analysis that lineage A was also associated with the market. So all of the early genetic diversity of SARS-CoV-2 was associated with the market. And the companion paper I mentioned actually finds that those 2 lineages were the result of 2 separate introductions into the human population of these viruses, probably representing 2 successful introductions out of 8 total. So 6 unsuccessful introductions, maybe 1 person got infected, but the chain of transmission died out. We know that SARS-CoV-2 susceptible animals were sold at the Wuhan market, including in November 2019, when the companion paper estimates the first human infections occurred. These included animals such as raccoon dogs, badgers, hares and rabbits, and foxes, all of which are known to be susceptible to infection with SARS-CoV-2. Finally, we were also able to reconstruct the floor plan of the market using information from a China CDC report that was leaked in 2020, but later confirmed as authentic by the China CDC preprint I mentioned before, information from the WHO Origins mission, and business registries of the market that we were actually able to reconstruct and identify the 10 to 15 stalls within the market that were selling live animals. 5 positive environmental samples from the market came from one single one of those stalls, and the samples came from items within that stall associated with the live animal trade, such as animal cages, carts used to transport cages, and a drainage grate underneath that stall. In general, environmental samples within the market clustered within the southwest corner of the market, which is where a disproportionate number of the live animal stalls were located. And the distance to a live animal stall was actually predictive of the likelihood of environmental positive. Additionally, although overall throughout December and January, human cases were scattered throughout the market, all 8 cases identified before December 2020 came from the west side of the market, where live animal sales predominantly occurred. And the last thing I'll note is that while these findings in this paper and the companion paper really give us a high degree of confidence that the first human infections of SARS-CoV-2 occurred at the Wuhan animal market, there are still many events upstream of the market that remain to be elucidated. So the specific source of the animals that were probably brought the virus into the market, whether there were early infections in animal traders or people who worked on animal farms, and also understanding perhaps how and whether greater regulation of the live animal trade could be implemented to reduce the risk of similar spillovers in the future. And so I'm happy to take any questions.
Thank you, Dr. Goldstein. I think I can get this started. You know, this has been a long time coming, finding this definitive research, or this part of the research that your team has been doing. Based on what you're saying, was it sort of a matter of time that something like this might happen if there are certain animals that are more susceptible to SARS-CoV-2? I mean, I know that there are all different kinds of SARS viruses. Was this something that was bound to happen, or, you know, from what you've learned, were there other precautions that might have been taken? I mean, I know hindsight's 2020, but is this something that was just going to be happening in nature at some point anyway?
So it's certainly not a surprise that as long as live animal sales are occurring under these kinds of conditions, that spillovers such as this will occur. So this happened in November and December 2002 in southern China, with the first SARS virus spilling over from live animals sold in markets. And similar to what we estimate happened here with 2 introductions, there were likely multiple introductions of that virus into the human population emanating from those markets. It's kind of remarkable that actually one of the co-authors of this paper, Eddie Holmes, who's at the University of Sydney in Australia, was taken to the Wuhan market by Chinese public health officials in 2014 to show him as an example of a place where further spillovers of SARS-related coronaviruses might occur. So, and there were certainly numerous papers and review articles in the period between 2003 and 2019 expressing concern, if not actually predicting, that further spillovers of related viruses might occur. So it shouldn't be surprising at all. As to what kind of measures could have been taken or could be taken in the future to minimize further spillovers, you know, I would leave that primarily to experts in public health and animal ecology, experts in the live animal trade, throughout the world, in particular in China and Southeast Asia, to kind of really give specific, prescribe specific measures that might do those things, but certainly things like testing, surveillance testing of animals on farms and farm workers who might be routinely exposed to these kinds of viruses, to try to remove infected animals from the supply chain as best as possible would be one thing to do. And then, any kind of regulation of the live animal sales in cities would potentially reduce the risk of further spillovers as well.
Thank you, Dr. Goldstein. We have a couple questions in the chat.
Sure.
Roger McDonough says, do you expect pushback on your analysis from people who would prefer that there was a different origin story for this virus? We live in a world where conspiracy theories spread without regard for what careful analysis or carefully gathered evidence appears to show. So are you anticipating that there could be pushback from conspiracy theorists, and what can you do to combat that pushback?
Yes, of course, we expect pushback from various interests, various types of people, both in the United States and potentially in China as well. The Chinese government has sort of pushed a narrative that the virus may not have originated there at all, but rather have been imported into China. Although I'll note that in February 2020, the director of the China CDC, his initial statements on the origin of the pandemic were that this emanated from live animal sales at the Wuhan market. But yeah, we expect pushback. I think the best thing we can do is to publish in the scientific literature following extremely rigorous peer review, which both of these papers underwent at Science Magazine. And we're really grateful to the reviewers and editors who helped improve these studies compared to the first versions that we released as preprints earlier this year. And then, of course, to engage with the media as best we can and try to communicate these findings to the general public. But I'm certainly under no illusion that we're going to completely, stamp out competing narratives.
And this is a bit of a follow-on to that question. Lisa Riley Roche wants to know, do these findings then rule out the theory that the virus originated in a Chinese lab?
So I think essentially the short answer to that is yes. So, a few things is that as I mentioned, the only place that this virus was circulating in December 2019 is the area immediately surrounding the Wuhan market, which is quite a distance away from the Wuhan Institute of Virology. That's been suspected as the source. I think a really key point that actually comes from the companion paper, the first author of which is Jonathan Pekar from University of California in San Diego, is that these two lineage A and lineage B, these early variants of the virus, are the result of separate introductions of this virus into the human population. So of slightly genetically diverse versions of this virus. So not a single introduction that you might expect if a lab worker was infected and then brought the virus to somewhere else in the city, but that this virus actually entered the human population twice independently, two successful introductions. As I mentioned, and has been previously modeled, something like 75% of introductions of first infections are expected not to be successful, meaning not to result in continuous onward transmission. And so to get two successful ones, we actually estimate, or the authors of the Pekar paper estimated that there would have been 8 total introductions. So I think that's obviously inconsistent with the idea of one worker being infected in a lab.
Another question we have here from Jamie Lampros, and she's also asking about the lab, which you answered, but she said, what about the bat theory? I feel like that was something that we heard about early on in the COVID pandemic as well.
Oh yeah, so there's no question that the ultimate source of these viruses, where these viruses circulate, is in bats. But two things are, kind of suggest the idea that there's what we call an intermediate host. So for one thing, we know that in the original SARS epidemic in 2002 and 2003, there was clearly an intermediate host. Animals such as raccoon dogs and civets were found to be infected with the SARS-1 virus, both in markets in southern China and actually also in areas in central China, pretty close to Wuhan, sometimes in the same province, Hubei province. There were multiple detections of the virus in civets. Additionally, humans don't have particularly intense contact with bats. We have much more intense contact with these potential intermediate hosts in places like live animal markets. So the most likely way for these viruses to go from bats to humans is through an intermediate host, and particularly for human infections to occur in cities. So we expect that if infections occur in rural areas, that most of those are even more likely to die out than infection than a transmission chain that's initiated in a densely populated city. But I think the question of how bat viruses infect these intermediate hosts is one of these key upstream events that it would be better to understand. Can we limit the contact between wild bats that carry these viruses and animal farms, for example? And there are examples where that's been done successfully with a virus called Nipah virus in Malaysia, for example. And so it's not impossible to do that, whether it's relocating those farms, modifying the enclosures on those farms to limit contact, limit viruses mixing between species. That's how they can ultimately end up in the human population.
A related question to that, Dr. Goldstein, how are coronaviruses different between humans and animals? I mean, we know coronaviruses have happened for a very long time. And how has this transfer happened before? And why is it that types of coronaviruses can spread so quickly, certain types?
Yeah, so these types of transfers have happened with other coronaviruses before. So before SARS-CoV-2, there were 4 other coronaviruses that were known to circulate routinely in humans and cause mostly mild respiratory disease, although with the potential to cause severe disease when they get into vulnerable populations like older adults in nursing homes or assisted living type facilities. And all of those have an animal origin. So 2 of those are believed to actually have an ultimate origin in bats. Closely related viruses have been found in bats in other parts of the world to the current human viruses, and 2 are believed to have their ultimate origin in rodents. And so we know this has happened successfully from the standpoint of the viruses at least 4 times previously, and no doubt there have been other unsuccessful spillovers from animals to people of zoonotic coronaviruses. So yeah, I mean, these events are not super common, but they're also not unheard of at all, and have seeded viruses before that circulate all the time in people.
And Roger McDonough has a follow-up question. Does this research give us any greater understanding of how quickly it originally came to the U.S.? There were a number of suspected infections here earlier, maybe like January or February of 2020. So looking back on that now, which we do have the luxury of time now to look at how that might have happened, what are your thoughts on that based on the research you've done?
So the first case in the United States, as best I can recall, was identified on January 16th in a traveler from Wuhan. It's possible that there were some earlier introductions of the virus that didn't go anywhere, but it's pretty clear that the earliest successful transmission chains entered probably in Washington State in early to mid-January 2020, and then that was actually a lineage A virus. There was a successful introduction into British Columbia around the same time. And then lineage B viruses were seeded primarily from Europe into the East Coast of the United States, especially New York City, probably late January, early February of 2020. So there's really no evidence. The best evidence we have from these papers, and particularly the PCAR paper, is that the first human infections occurred in mid to late November of lineage B viruses, and then lineage A viruses about a week or 2 later. And so, the idea that there were major introductions of the virus outside Wuhan in December 2020, probably extremely limited, and that the virus really only began to spread globally at the end of December and early January end of December 2019, early January 2020.
Lisa Riley Roach has another question. Does this study and your research on this study help explain why this version of SARS-CoV-2 was so successful in spreading worldwide?
So I think these studies don't specifically speak to that, but I think the answer for that is just that actually many of these viruses are probably reasonably well adapted, even in bats, to infecting human cells. So other related viruses have been found in pangolins, in bats, in various parts of China and Southeast Asia, that when people have studied them in the lab are perfectly successful at infecting human cells, just as they bind to human cells with the same high degree of affinity as SARS-CoV-2. And so it's entirely possible that the reason these events are relatively rare is just because the ecological conditions for the spillovers are not occurring every day, rather than it being extremely rare for these viruses to be able to infect people. But we don't totally understand necessarily what, if there are determinants that specifically make one of these related viruses more able to transmit very well in people than another. But it's pretty clear that the ability to infect human cells is not especially rare.
And then Roger McDonough is wondering if you could just give general comments on the wildlife trade. What types of viruses may make that leap a little bit more than others, and how, I know this is a big question too, but how to make that more preventable going forward, if you have any thoughts on that.
Yeah, so the live animal trade, certainly we know, has the potential to bring viruses from rural areas into urban areas. And when these viruses appear in urban areas, that's when you have the potential to have explosive transmission like we saw in Wuhan, and then that spreads throughout the world. And there's been some recent sampling of animals in live animal markets in China that hasn't uncovered additional SARS-related coronaviruses, but many other animal viruses, dozens to hundreds of viruses in animals like civets and raccoon dogs that are not natural pathogens of those animals, but because of the live animal trade, where different kinds of animals are placed together, that allows for species jumps from one animal to another, similar to species jumps from an animal to humans, and a concentration of viruses that should be in rural areas into urban settings. As far as trying to prevent those kinds of things, I think one of the key measures that should be taken is active surveillance for these viruses at what we call a human-animal interface. So that means detecting unusual infections in people who are working in the live animal trade upstream of these urban areas where the viruses can be introduced. So farm workers, animal traders, people in rural areas who are exposed to the animals that potentially carry these viruses. And that would really provide kind of an early warning system to be able to remove animals from, say, infected farms from the supply chains, keep them out of urban areas. Even if there are one or two off infections in rural areas, those aren't going to, then we can prevent those from turning into a pandemic.
As a virologist, has the intensity of this pandemic and how deadly it has become, has this surprised you to see how this coronavirus has taken hold and spread in the way that it has?
That's a great question. A little surprising, but not shocking, I would say. In I think very early January 2020, there was still some hope that this could be contained. But by late January 2020, and I think some of that hope was based off of the first SARS epidemic, which ultimately was contained. It caused 8,000 cases globally and was probably a close call, but was able to be contained because of some differences in the nature of the two viruses. I think in early January 2020, there was still some hope that this could potentially be contained, but by late January 2020, it was pretty clear that we were going to see transmission of this virus globally, and that it had the potential to be somewhat similar to, for example, say the 1918 influenza pandemic, which is was the worst pandemic of the 20th century. And so, I think it was, a little surprising, but not shocking. I mean, certainly people had warned of the possibility of this happening.
And then another question we have, if you were able to sum up, what you would like a reader or viewer to know about this topic, just high level, how would you do that? Or what would you say to kind of give us the big picture about what you want us to learn about your research? Yeah,
so I think this paper that I'm fortunate enough to contribute to in the companion paper really make clear that the first place this virus was circulating was the neighborhood immediately surrounding the Huanan market. Within the Huanan market, the virus clearly emanated from the section of the market that was selling live animals, not just any random part of the market. And that there were at least likely 2 independent introductions of this virus into the human population that produced successful chains of transmission. So both lineage B has dominated the pandemic, but both lineages of the virus successfully established themselves in humans, really refuting the possibility that this was just a lab worker that got infected. There were 2 early variants of this virus. Both were present at the Wuhan market and nowhere else in the city before, say, mid to late December 2019.